Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. Today, I'm going to share with you this interesting case of complete hydatidiform mole. So this is unfortunate 28-year-old female patient who had a twin pregnancy, but unfortunately, one of the pregnancy was discovered to be molar pregnancy. So the decision was taken to abort both. But this gave us the chance actually to examine and compare the normal pregnancy versus the molar pregnancy. So on the left-hand side, there is the normal pregnancy, the primary, secondary, and tertiary villi. And as you can see, there is minimal trophoblastic proliferation. Some syncytial trophoblasts are seen at the sides or at one pole of the chorionic villi. Others are seen within spaces in between the chorionic villi. And then the chorionic villus itself is cellular and contains vessels and red blood cells. Now, in comparison with the molar pregnancy, I think it's easy to appreciate the difference in the size. These are much more swollen, the presence of the trophoblastic proliferation, the absence, really the hypocellularity of the cores of the villi, and the absence of vessels. So on high power magnification, again, this is one of the villi from the normal pregnancy, and this is for comparison from the molar pregnancy. So in the normal pregnancy, it's cellular villus containing vessels as well as red blood cells. And it's important to note that the vessels within the villi, the core of the villi, and the red blood cells are of fetal origin. And then we have the normal regular proliferation of a trophoblast, both cyto and syncytial trophoblast at the periphery of the villus. Now, in comparison, this is a swollen, hypocellular, there is no vessels or red blood cells, and there is some marked proliferation of the cyto and syncytial trophoblast. And again, another villus for comparison. This is the normal pregnancy, the vessels and the red blood cells of fetal origin, while in the molar pregnancy, there is circumferential proliferation of the cyto and syncytial trophoblast, edematous pores, and the absence of vessels and red blood cells. Now, what we can establish at this point that we have normal pregnancy and we have a molar pregnancy. However, to differentiate between partial and complete mole, it's important to note a few things that are present within the villi and around the villi and can help us really to sort out this differential diagnosis, which is important because of the risk of transformation to malignancy in the future, which is much higher with the complete hydatidiform mole. So one of the first features that would really attract our attention in villi is the formation of cisterns. What are cisterns? These are spaces like cyst, big cyst, or spaces that have like a lining, and then they contain only edematous fluid, and the core or the tissue of the villus is pushed to one side. So this is number one clue that we're dealing with complete hydatidiform mole. Number two is the circumferential growth of the trophoblast, both the cyto, which are the mononuclear cells, and the syncytial trophoblast around a chorionic villus. So this circumferential syncytial growth is important to support the diagnosis of complete versus partial hydatidiform mole. Number three, that the syncytial trophoblast in particular appear to be abnormal with cystic spaces within the villi. So this is one big cell, this is another, perhaps multiple cells, but all contain these abnormal spaces and shapes of the syncytial trophoblast. Number four, if we look into the villi, into the core of the edematous villus, there is absence of vessels and absence of fetal red blood cells. Now remember that the vessels in the chorionic villi, in the cores of the chorionic villi, as well as the red blood cells within these vessels, are of fetal origin. So the absence of vessels and the absence of red blood cells denote that this is supportive of a complete hydatiform mole. Number 5 clue, which is not very well known or appreciated, is the presence of Karyorrhexis. Karyorrhexis, or a nuclear dust, is really an excellent clue that we're dealing with complete hydatiform mole. So remember these 5 criteria whenever you're evaluating a molar pregnancy, to separate between complete and partial hydatiform mole. So the final diagnosis of this case was complete hydatiform mole with all the risk for subsequent development of choriocarcinoma. I hope you find this tip useful in your daily practice. Thank you.